NEC section 517.18 addresses the requirements for hospital-grade receptacles in specific healthcare settings. This section mandates the use of hospital-grade receptacles at patient bed locations within hospitals, nursing homes, medical and dental offices, ambulatory care centers, and other patient care areas. However, the application of this requirement can sometimes be misinterpreted, leading to confusion and unnecessary costs. The key point of contention often revolves around the definition and interpretation of what constitutes a patient bed. The NEC itself does not provide a specific definition for patient bed. In the absence of a formal definition, the industry typically understands a patient bed to be a fixed or portable surface specifically designed for a patient to lie or sit on during examination, treatment, or recovery. These beds often include features such as headboards, footboards, or side rails to provide support and ensure patient safety. Now consider the application of NEC section 517.18 to exam tables commonly found in medical offices such as those of dentists, obstetricians, family practice doctors, and orthodontists. These exam tables are primarily intended for examinations and procedures, not for prolonged periods of rest or recovery. As such, they are generally not considered patient beds in the context of NEC section 517.18. Electrical inspectors may sometimes adopt a broad interpretation of the code, leading them to require hospital-grade receptacles for all electrical outlets within medical facilities. This interpretation goes beyond the intended scope of NEC section 517.18, which focuses specifically on patient bed locations and is not meant to blanket entire facilities with this requirement. If you encounter a situation where an electrical inspector is requiring hospital-grade receptacles for exam tables, it is essential to take a systematic approach to address the issue. Firstly, carefully review NEC section 517.18 to ensure a thorough understanding of its requirements. Confirm that the code does not explicitly mandate hospital-grade receptacles for exam tables. Secondly, document your reasons for believing that hospital-grade receptacles are not required in this specific instance. Prepare a written explanation of your interpretation of the code and support it with evidence from reputable sources. These sources may include articles from industry publications, opinions from qualified electrical engineers, or relevant technical bulletins. Thirdly, request clarification from the electrical inspector. Ask them to provide a specific code reference or a clear justification for their requirement. Understanding their reasoning is a crucial step in resolving the disagreement. Fourthly, consider offering alternative solutions to address any safety concerns the inspector may have. For example, you could propose using safety covers or lockout devices to prevent accidental contact with electrical outlets. Alternatively, you might suggest providing a limited number of hospital-grade receptacles in specific areas where patients are likely to be positioned for extended periods, such as dental chairs. In cases where you are unable to reach a resolution with the electrical inspector, it may be necessary to elevate the issue to a higher authority. This could involve contacting the local building department or the authority having jurisdiction, known as the AHJ, to seek a formal interpretation of the code. When presenting your case to the AHJ, be prepared to provide all relevant documentation, including your interpretation of the code, supporting evidence, and a record of your communication with the electrical inspector. Remember, the goal is to ensure compliance with the NEC while avoiding unnecessary costs and burdens on the contractor. A clear understanding of the code, effective communication, and a willingness to explore alternative solutions are key to resolving disagreements and achieving a satisfactory outcome. In summary, the following steps should be taken. Firstly, carefully review NEC section 517.18 and understand the requirements for hospital-grade receptacles in patient care areas. Secondly, determine if the location in question qualifies as a patient bed as defined by industry practice. Thirdly, if the inspector requires hospital-grade receptacles where you believe they are not needed, document your reasons and cite relevant code sections. Fourthly, communicate with the inspector to understand their reasoning and attempt to find a mutually agreeable solution. Fifthly, if necessary, appeal to the AHJ for a formal interpretation of the code. In the context of electrical safety in healthcare facilities, it's crucial to differentiate between general patient care areas and specific patient bed locations. The NEC acknowledges this distinction, and its requirements for hospital-grade receptacles are primarily focused on ensuring safety at the point of patient contact, particularly in areas where patients are likely to be vulnerable or have compromised immune systems. While it is important to prioritize patient safety, it is equally important to avoid unnecessary costs and burdens that arise from misinterpretations of the code. By following a systematic approach and engaging in open communication with electrical inspectors, you can effectively address any disagreements and ensure that your electrical designs comply with the NEC while remaining cost-effective. Additionally, it's worth noting that the definition of patient bed can vary depending on the specific context and the type of healthcare facility. For instance, a patient bed in a hospital intensive care unit will have different requirements and characteristics compared to a patient bed in a nursing home or a medical office. Therefore, it is essential to consider the specific use case and the level of patient care provided when determining whether hospital-grade receptacles are required. In some cases, it may be prudent to consult with a qualified electrical engineer who has expertise in healthcare facility design to ensure that your electrical designs meet all applicable codes and standards. These engineers can provide valuable insights and guidance on complex issues related to electrical safety in healthcare settings. Furthermore, it is important to stay updated on any revisions or amendments to the NEC that may affect the requirements for hospital-grade receptacles. The NEC is typically updated every 3 years, and these updates may include changes to existing code sections or the introduction of new requirements. By staying informed, you can ensure that your electrical designs always comply with the latest codes and standards. In conclusion, the proper application of NEC section 517.18 requires a thorough understanding of the code, a clear definition of patient bed, and effective communication with electrical inspectors. By following a systematic approach and seeking expert guidance when necessary, you can ensure that your electrical designs prioritize patient safety while remaining cost-effective and code-compliant. Remember, patient safety is paramount, but it is equally important to avoid unnecessary costs and burdens that arise from misinterpretations of the code. NEC section 517.18 is not intended to require hospital-grade receptacles for every outlet in a healthcare facility, but rather to focus on specific patient bed locations where enhanced electrical safety is essential. Therefore, it is crucial to carefully evaluate each situation and determine whether the location in question truly qualifies as a patient bed before specifying hospital-grade receptacles. If you are unsure about whether hospital-grade receptacles are required in a particular location, it is always best to err on the side of caution and consult with a qualified electrical engineer or the AHJ. These experts can provide valuable guidance and ensure that your electrical designs meet all applicable codes and standards. Finally, remember that the ultimate goal is to create a safe and effective healthcare environment for patients and staff alike. By prioritizing patient safety and ensuring code compliance, you can contribute to a positive and healing experience for everyone involved. NEC 517.18 also mentions other patient care areas, and it is important to understand the definition of this term as well. Other patient care areas refer to spaces within healthcare facilities where patients receive medical treatment or care but are not necessarily confined to a bed. These areas can include examination rooms, treatment rooms, procedure rooms, and waiting areas. The requirements for hospital-grade receptacles in these areas may vary depending on the specific type of care provided and the potential for patient contact with electrical equipment. For example, in an examination room where patients are briefly examined and do not require any electrical equipment for treatment, standard receptacles may be sufficient. However, in a treatment room where patients may be connected to medical devices or undergoing procedures that involve electrical equipment, hospital-grade receptacles may be required to ensure patient safety. It is important to carefully evaluate each area and determine the appropriate level of electrical safety based on the specific risks and requirements. Another important consideration is the type of equipment that will be used in each area. Medical equipment that is intended to be used in patient care areas must meet specific safety standards and requirements, including requirements for leakage current and grounding. Hospital-grade receptacles are designed to provide a reliable and low-impedance ground connection, which helps to minimize the risk of electrical shock to patients and staff. Therefore, if medical equipment that requires a hospital-grade receptacle is being used in a particular area, then hospital-grade receptacles should be installed in that area. In addition to NEC 517.18, there may be other codes and standards that apply to electrical installations in healthcare facilities. For example, NFPA 19.9, Standard for Healthcare Facilities, provides requirements for electrical systems in healthcare facilities, including requirements for essential electrical systems, emergency power systems, and grounding. It is important to be familiar with all applicable codes and standards when designing and installing electrical systems in healthcare facilities. It is also important to consider the potential for future changes in healthcare practices and technology when designing electrical systems in healthcare facilities. Healthcare practices and technology are constantly evolving, and new types of medical equipment and procedures are being developed all the time. Therefore, it is important to design electrical systems that are flexible and adaptable to future changes. This may involve providing additional capacity and spare conduit to accommodate future equipment and wiring. In addition to the technical aspects of electrical design, it is also important to consider the human factors. Electrical systems in healthcare facilities should be designed to be easy to use and maintain, and they should be designed to minimize the risk of human error. This may involve using color coding, labeling, and other visual aids to help users understand the system and operate it safely. Finally, it is important to remember that electrical safety is a team effort. Electrical engineers, electricians, healthcare providers, and facility managers all have a role to play in ensuring electrical safety in healthcare facilities. By working together and communicating effectively, we can create a safe and effective healthcare environment for patients and staff alike.